Get it. That's the key.
While monkeypox is now a federal public health emergency, Florida Governor Ron DeSantis says he will not declare it one in the state, despite more than 500 cases here. To talk about what this means for all of us, Dr. Shalika Katugaha, the System Medical Director for Infectious Disease at Baptist Health, is joining us. Good morning to you.
Good morning. Thank you for having me.
This is a hot topic, Doctor, and it's becoming very political. You can see the governor taking a stance here, his opponents coming out differently. What we really want to look at is, what does it mean to be a public health emergency? So federally it is right now. Let's talk about what that actually means for the general public.
Sure. So yesterday, Biden went ahead and made this a federal emergency. So what a public health emergency is an event that's usually exigent. It's an event that outcomes could be calamitous, and it's an event that usually cannot be avoided by other ordinary means. So it speaks to two factors. One is resources for people, and one is response. And so in terms of resources, it's not just funding, which it is. It's using emergency money for a rainy day, but it's also resources in terms of personnel, assembling task forces. It's also the amount that agencies report back. And then it's about education. So many doctors have never seen monkeypox before. So it's educating doctors as to what to look for, how to test, because our tests are highly underutilized right now, how to get vaccine and how to get antivirals. And then on the other side, in terms of response, for the protection of safety of individuals, we have some safeguards. For example, what I'm talking about is paperwork in terms of getting, and qualifications in terms of getting the antiviral agents or the vaccines. So hopefully by making it an emergency situation, we can actually get rid of some of these, what we are now almost becoming barriers to get doctors access to things that they need.
There's a stark difference right now between the federal government and the state government. President Biden, Governor DeSantis have a very different viewpoint on this. What does that mean for the doctors and ultimately the patients who want that care?
Sure. So I'm a medical expert, and what I can speak to is that we still have resources in Florida. So I want to let everyone know that we still have resources in Florida and how to get them, and that's why I'm here.
Okay, so certainly we do have the resources here. You're looking at this situation, and it seems like the early days of COVID-19, when we were trying to learn about testing, about what the treatment options were, about educating the medical teams as well as the general public. Do you see that relation?
Yes, so certainly this is a public health emergency because it could spiral. So what we need to do is act now and work now to prevent this from becoming a general commonplace virus that we're all seeing. And so we have a vaccine available. And so the vaccine is available in Florida, and it is available through Duval. And so right now, whenever there's a limited supply of a vaccine, it's rolled out. And so right now in Duval, we're in something called phase 1, which means only those who are very high risk get it. But the goal will be to get it to all individuals who can potentially get it, which would be, all men who have sex with men, all individuals who have high risk sometime in the near future.
Do you think in the future we're going to be seeing a push from the government and from medical experts for everybody to have the vaccine?
It's hard to say right now. It is a vaccine that's in limited supply. And so right now what the focus is on individuals who are at highest risk for getting this.
And finally, let's go back to monkeypox. Let's look at the broad picture. What are some of the first signs and symptoms that someone may have this and needs to go see a medical expert right away?
Sure. So first off, it's rash, and the rash, I'm sure many people have seen pictures now, but they look a little like pus-filled blisters, or they can be hard, they can be painful. Other symptoms are malaise, fever, prominent lymph nodes. So anytime anyone sees a rash now, and they could have potentially been exposed, or they just have a rash, we're encouraging individuals to seek health care guidance.
Go to a doctor. Go to the hospital, go to somebody who's researching this, who knows what the treatment options are. Yes. Thank you so much, Doctor, for coming on, representing Baptist Health. And we know that we're going to have to continue this conversation because we are really just getting to the point where it's going to be something that we're going to have to continue to talk about and to be aware of, whether we like it or not.
Absolutely.
We appreciate your time this morning.